After a while, doctors began to realize that these were people who had survived the Spanish flu back in the early 1900s. And much in the same way, that virus had attacked their nervous system, much like the COVID-19 virus attacks our system. So it can have effects that go beyond just surviving the immediate health crisis of the virus. It can go, we may be seeing effects of this showing up later, and we're certainly seeing effects right now show up in children who have survived the virus with very few symptoms, but then are going into a health crisis because of the long-term neurological effects of the effect of the virus on tissue. So let's take a look at how we do this. And please feel free at any point to enter into the chat box or jump in with questions that you might have. But particularly with our families, we find that we have disproportional health effects on Native families. So a way of saying that is that the COVID-19 virus is very likely to affect Native families much more than other populations. And that has to do with things like metabolism. It has to do with issues like pre-existing health conditions. It has to do with issues of being able to even care for one another within our homes. It also has to do with issues of the community and the family being disengaged and distanced at a time when we really do need each other. And one of the impacts that it has had is loss of cultural ways and community health ways. The things that keep us healthy usually are things that bring us together. And so in this way, we have many, many challenges to overcome with this coronavirus, this novel coronavirus. Now, it's important to state that here that, I'm not giving any medical advice, but also that there's a lot of hope here. This is not, I don't want us to all leave depressed today. I want us to understand that there are things that we can do in our work immediately that will help to change the effects of this virus on our families and our people. So first, I want to talk about the disproportionality of health risks that impact, and those mainly fall into two areas. Health disproportionality basically is a fancy way of saying that that this virus, as well as many other things, will disproportionately affect us as Native people differently than it will other people. And much of that has to do with underlying health conditions and underlying issues that we may not even be aware of from a health perspective, and that we may not feel like we have a lot of control over. The other issue, though, about disproportionality is intergenerational trauma experiences complicate at least health risks to people. And particularly, it sets the stage for specific health risk areas, as we found in the ACEs studies. If you're not familiar with those, please look it up. There are, adverse childhood experiences studies that directly relate likelihood of specific diseases and specific health problems to the immediate experiences that you've had directly as a child and as a family early in life. Now, those intergenerational effects compound that and serve as a way of multiplying those effects. So health disproportionality is specifically governed by some issues that, if you would think of this as, these are things that are common in our community, but that put us at higher risk for being affected by this coronavirus. Respiratory conditions, chronic respiratory conditions like asthma, problems of breathing like sleep apnea. You'd be surprised how often we see sleep apnea within our communities. Lung problems, just having our lungs that are stressed, and when you can imagine the various ways that lungs can be stressed, but we're more likely to respond to that due to some health issues and some environmental issues. Don't discount how much our environment plays a part in that. The spraying of our forests in our communities and how that affects us. The fire conditions can affect us. Also, we can be affected by pollution in the air and water. So these things are important to think about and to realize. Diabetes mellitus is an additional complicating factor because it to some extent complicates our body's ability to fight off the disease when exposed to it, and puts us at a higher risk for being susceptible to the disease. So I'm kind of talking at a very kind of technical level in some ways about the disease processes. And to get more information on this, I would work closely with healthcare providers and really get an idea of how that happens. What is that process like, so that we can begin to change behaviors? Of course, chronic alcoholism and substance use can lead to chronic liver disease and cirrhosis. And these are problems that that are very likely to continue and to maybe get worse with the isolation of people needing to stay at home. There are also complicating factors in our ability to stay safe from exposure to the virus. And we'll talk a little bit about that later. High prevalence of sugar-sweetened beverages, sodas, pop, poor diet, things like that can be complicating factors. Leisure time physical inactivity. So what does that mean? Well, that means gaming can sorry to bring you this news. Gaming, watching TV, binge watching, all of that. While it can be fun at times, over a long period of time begins to put you at higher risk because you're not exercising out toxins and so forth of your body. Overweight, of course, as a part of that, or as an adjunct to that, being overweight or having obesity at various levels, having high blood pressure can also put you at increased risk. So these are relatively well-known risk areas for the novel virus, but they are also well-known as being associated with many of our communities. We don't have to look hard or look far to find these ailments within our communities. And particularly we want to pay attention to specific areas that we see that our community suffers from or is impacted by more than others. Let's not underestimate, though, the nature of intergenerational trauma experiences. Trauma experiences are associated with increased risks of drinking and substance abuse. So why is that? Well, remember that our trauma experiences and our trauma responses are governed by our what we might call epigenetics, so our microgenetics, and that genetic memory carries some of our intergenerational trauma that our families have experienced. And without going into all of those traumatic experiences, because that's probably a different workshop, we know that it causes symptoms similar to post-traumatic stress symptoms. But the difference is that someone who has post-trauma issues is fairly aware of why they have post-trauma issues. They can associate it to experiences that they remember. Intergenerational stress is very different. We feel the same anxiety, we feel the same unsettledness, we may feel the same dissociative symptoms where we check out, and we don't know where it comes from. We just have a sense that, you know, other people don't seem to have to deal with this, and that leads us to have increased stress and increased feeling of living in crisis. And as we do that, then because it's unconscious, we get unconsciously drawn towards things that will give us temporary relief. And of course, that tends to be alcohol, drugs, food, and vegetation sitting around. And so people that have these symptoms are at very highly increased risk for being exposed to and suffering dramatically from the novel virus and other viruses that are around. Depression is a part of that. You don't have to look too far. And then post-traumatic stress caused by specific experiences that the person may know. So they may remember, and that's just an added layer. Many times when I talk to people who are relatively unaware of the intergenerational trauma that we as Native people have experienced, they'll say, you know, well, what can we do? And I'll say, well, you can stop doing it. You can stop causing trauma, because every generation is experiencing a different and new level of trauma that's compounded upon all the traumas that our people have been through throughout time. So we are in a unique position as therapists, as child welfare workers, as helpers within our communities, of treating trauma and the trauma experiences of our families and youth while the traumatic experiences continue. And so we can't always guarantee safety. People don't always feel safe. And that, of course, leads to generalized anxiety. And I always put with generalized anxiety anger, because it's more, when someone is highly anxious, you're more likely to see that as anger or rage than you are anxiety. There are some people that will say that, you know, you don't need to know them too well to know that they're very anxious. But there are other people that you experience as being very angry or very rageful and really don't know why. Well, that is usually a symptom of either agitated depression or anxiety. And so it's going to take a little while for them to figure that out with therapeutic help. And certainly if there's any questions about these, just jump right in and we can talk about them. So why does the coronavirus impact us with increased risks for child maltreatment and domestic violence? Well, it happens in many ways. We have a decompensation, what we call decompensation of a family that can occur in isolation. So if you think about this, I once worked in a community where in the mountains, and in this particular community, when it snowed, the roads closed around the valley. And at that time, we would have a dramatic increase in domestic violence, and substance abuse, in mental health referrals, school referrals for mental health, and child maltreatment referrals also. And it was interesting that would happen when it snowed, because I kind of like snow. But what it was is that the community became isolated. You couldn't get out of the valley. And so therefore, when you couldn't get out of the valley, it's a little bit like being locked in the closet with all your relatives. And for some of us, that can be very stressful. Probably for most of us, that would be pretty stressful. And Susan, if you see any comments or any raised hands, please just feel free to interrupt me. I'm not sure I can see them.
Well, dear, I'm keeping my eye out.
Okay. So what else contributes to high risk for domestic violence? Well, of course, increased substance use is going to impact us. And as you get people who have substance abuse issues and who are now stuck at home, what are they going to do at home? Well, they're going to use substances at home. You're going to find that there's an dramatically increased amount of stress that our families are going through right now for a number of reasons. And it's a little bit like a double-edged sword. We have some of our families that are at increased stress and dramatically increased stress because they're out of work. And that is a huge stressor for their family. And they can't find work. Maybe they've been looking for work in the past and now really can't find work. And then you have the other part of our community that is working, but a large percentage, a majority of those folks are working in what we would call essential roles. Essential roles like working in food service and working in stores and department stores and other areas, even warehousing, that puts them at dramatically increased risk for coming into contact with the virus itself, either through something that they are attending to in their work, or just having contact with a multitude of people directly who may or may not be wearing a mask. I don't know if you can see, but I'm wearing my little mask today in case I run into folks. And I'm trying to get clients in the habit of wearing the mask even when they don't need one. So wear a mask around your neck, and then when there are times when you need one, you just simply pull it up. You don't have to go looking for it. Also, when people get increased stress, when there's increased stress in a home, what happens? Well, we tend to not say to folks, I'm feeling very angry right now, or I'm feeling very stressed. I'm feeling like I need to talk. That might be nice, but that's not what we tend to see. What we tend to see is people project that anger onto others. So you're the reason I feel this way. We also have family isolation that exists, which of course compounds all this. And we have, there again, we have a double-edged sword of family whom we are used to being around, our extended family and community, who bring us strength. And so we're isolated from them. But on the other side, we can also have extended family that lives with us. And then we're at compounded risk, because those who are working, those who are going out in the community, are bringing that risk home with them to a multitude of people. So when they say if you've been exposed to the virus, or you have been maybe you have symptoms of the virus, to isolate yourself for 14 days. Well, you're isolating yourself with your extended family for 14 days. And many times we'll see that is a common way of passing the disease on to one another. So multi-generational homes are a high risk. Does that mean we should not have multi-generational homes? No, it means that we need to take particular care of the families that have multiple generations living in their homes. We also have problems of access to care. And one of the ways that that is most dramatic is through our traditional ways. Our traditional and cultural medicines, um, our, our ability to access those has really suffered for a couple of reasons. One is that when we feel like we're not healthy, we want to practice our cultural ways, however they might be, even larger community celebrations. And what we find is that we don't want to participate in those specifically because we might expose each other to virus. And we really don't want to call upon healers in our communities to help us because they're respected elders generally, and we wouldn't want to expose them to the virus. And so it becomes a very insidious way of kind of isolating us from the very things that make us strong. One thing to think about in that is that maybe it's time for us to fall back a little bit on our traditional medicines, but to learn those as home health practices. So we might call an elder or a healer from our community, and rather than saying, we need to bring our whole family over and have a ceremony, we might ask them, are there medicines, could you pray for us? And we pray also. And are there medicines that you could see that would help us with the symptoms, with the prevention, and with caring for one another? So family care, that ability to provide care within our families becomes a very important part of our, at least now, if it wasn't before, our way of caring for one another. So think of grandma's cabinet and all the jars of tinctures and herbs and so forth that you might have found in there. I know with my grandma, she always had a remedy for something. But also remember that how did they come by those? Well, they picked them, and they picked them with us generally at certain times of the year. And so when it's that time of the year, remember that you as a family can go out and get those medicines in the prayerful way that they were harvested by doing that and asserting yourself to taking a stand for the health of your own family. And it can be done in a very safe manner. Since it's outdoors, if you practice safe distancing, if there's others there, if there are people within your same home, it provides an enriching and healthy activity for you to do together. Also remember that our ability to provide clinical care and hospital care, to access that care when we're sick is very diminished within our communities. We have many things that impact that, but in many of our clinics, you can't enter the clinic if you have symptoms that might suggest COVID-19. Mental health issues are also hard to access, and I'm going to go in a little bit more specifically into some of these. So in our traditional ways, it's important to remember that some of us have always also lost traditional elders and leaders. And I'll say to you that within my extended family, I have actually lost a ceremonial leader who ran ceremonies, and without knowing how that might affect them. And I tend to think that they already knew that it would affect them, but they had an obligation that when someone asked them for traditional assistance, that they were obliged to respect that and to conduct ceremony. and they passed away. And it was a big loss for the community. It was a big loss for our family, of course. And within our extended family, we've already lost 3 people to the coronavirus, and there may be others that we did not in our community that we just don't know that was the actual cause. So amongst our traditional leaders, we have to really take care of them and be cautious about what we expose them to. We send our relatives to a hospital many times if they have this virus, knowing that we may not never see them again, and that feeds into an old thought process that we tended to have within our families. That hospitals are a place you go to die, and in this case, there are some things that would reinforce that in the way the medicine is provided. A big part of our healing, traditionally and even in modern day, is that we sit with our relations when they're in a hospital. In our family, and probably in most families I know, we have a process of sitting and being with our relatives, and the thought being that no one should ever be alone in a hospital. I can tell you funny stories that elders have told me over the years about, don't let me be in the hospital alone, because things will happen to me, and that was a big part of how we were raised, is that we don't let people who are sick be alone. We don't let people who are in hospital be alone. So hospitals don't particularly like to see our family coming. When we lose a loved one, and during this time, we're actually denied the mourning process, the support of our community. And when someone is lost, whatever the cause of that loss might have been, when they pass on, the community support of everyone coming together and honoring their life is a vital part of the healing of the family, the healing of the community, giving the family hope, and knowing and communicating to the family that we stand with you during this time of need. And we can't do that often with the coronavirus. And we need to explore ways that we can do that. I'll talk about that a little bit. Family care, caring for one another, is like I said, we used to look in grandma's closet and she'd find something in there that was going to be a remedy for our pain or for our aches and illness. We, as we isolate ourselves, we feel disconnected from the family around us, and there's 2 ways that happens. Also, we feel we don't have the support and the help we need from our family members, but we also tend to become more isolated and more troubled when we're away from family members, simply because there's no watchful eyes on what is going on within our homes. And then the whole thing of essential workers, bringing that exposure back to multi-generational families is a big concern. It's interesting that those are usually the lower paid workers within an environment. And that also goes with our health workers, our people who work with our Indian health clinics, community health workers, and prevention workers. So we've had to curtail a lot of those services during this time. Clinical care, as I said, we have a hard time getting into a clinic. We also tend to get referred to hospitals or to county services that Many of our families just won't follow through on that referral to see if they have the virus or have been exposed. In many of our areas, there's a lack of reliable power, internet, and phones that impedes even the best attempts to connect with our clinicians. Why is that? Well, in clinical care, much of our medical visits now are being done through the internet or over phones, smartphones, and so forth. And if you don't have good connection, it's very hard to access those services, particularly if you haven't done that before. There are more secure systems that we use in clinical care with clients of our projects, but those use up increased bandwidth. So that means you have to have a really good connection in order to do that. In some of our areas, we're blessed to have those, but in many of our communities, we have little or no good connection at all. And then also that our clinics are just less available to us. We have decreased schedules that they can see people, and a long process of screening that people have to go through in order to get into the clinic. And we have found in some of our clinics locally that people will, they'll just disguise their symptoms just because they want to, get in the door and be seen. And so we've had several people in clinic that have been turned out to be positive for COVID. And then that debilitates the entire system, because then that doctor, that nurse, that provider, all the people who worked in that section then have to quarantine themselves for 14 days, which means that for most of our clinics, a large part of that clinic is shut down. Excuse me. So the disabling issues of the coronavirus has an impact on our cultural ways and our ability to grieve and our losses that we have in our community, our fear that we have that someone could be lost that comes down with the virus. There's that inability that I spoke of our families to kind of what we call hold vigil with their loved ones, to not have them sit alone. With the knowledge that when people go to the hospital, we may not be allowed to see them again. We very likely will not be allowed in their hospital, but we also very likely will not be allowed in the hospital at all, because we have been exposed through them to potential risk. And so we have the hardship on our feelings and our emotions that our relatives may die alone. And in our family, that is one of the saddest things that can happen. Our traditions, such as holding the casket in the house, we typically would bring the casket to our homes in many communities, where we would have either ceremony or viewing, prayer for our loved one. That can't occur anymore for a number of reasons. One being that the funeral officials won't do that anymore, and the other one is that we really can't come together like a family in that way. Our cry dances and cries have been diminished, although that not necessarily so. Remember that these ceremonies of parting with our loved ones can be done outside. They can be done for the family without having to have a large community gathering. There can be social distancing, and there must always be social distancing, and there must always be masks that are worn in order to prevent spreading the virus amongst one another. And really, the only thing that we've had to give up on that level is the size of the community that can come together, as well as the food after. So that's something that we've had to deal with, is that we don't have a meal after. So it's impacted our ceremonial ways, and it's impacted our ceremonies to the extent that we have to be really thoughtful about what we do and how we do it. So I want to be sure that we have time left over for questions and discussion. But let's talk about some solutions. We're resilient people. You know, there's a fine line between resilience and stubbornness. So I'm going to say resilient. We are resilient people, and we can turn something that is a challenge into something that is an opportunity. And I need to go no further than look at fry bread, right? Giving us flour was a challenge because we didn't particularly want flour. But we turned it into an opportunity, and it became one of the things that drew our families together was fried bread. And now it's a staple that we're trying to get rid of. But there are many, many things in the history of our families and communities that we have seen as being challenges that are have been turned around, and we've made a place for them. So I want you to think about COVID virus and other viruses, because this may be the first. Remember that these prophecies were forecasted by elders and through many generations, that there would become times of hardship and disease, and that it wouldn't just be one disease, it would be several. So we need to be prepared. One thing that we can do is use every technology that you have to stay, it says state, but stay in constant and frequent connection with everyone in your family, particularly elders. When elders feel isolated, their health goes down, it declines rapidly. There are, and just the change from maybe someone in their family came by, twice a week to visit with them. If they're at home alone, maybe they're in a nursing home. And we need to think about that also, about is the risk we're exposing them to better than the risks that might be in their own home or in their own family. And also never forget, particularly for frail or fragile elders, there's an increased risk in just moving them. Just having a different environment that they're looking at is a very significant risk for many elders. And so we want to pay attention to our high-risk relatives in particular, such as elders. People that are maybe isolating for 14 days, we want to encourage them to isolate, but we also want to stay in constant contact with them. We have FaceTime, we have, all these tools at our discretion now. Stay in contact with people. Don't let them feel isolated, because then it will increase their susceptibility to any symptoms. We can also do things like being outside together and practice social distancing to teach our children ways and allow our elders to teach us. So what I'm talking about is getting together in maybe larger circles within a small family and saying, we can't do anything right now. We can't go anywhere right now. How about if we use this for a time to teach? How about if we use this for a time for family gatherings of just our family, that we can talk about our ways, that we can connect to each other, and that we can do many of the things that we probably should have been doing before, like telling stories to our children and other family members about how we used to live and the stories that guide our lives, the way that we are supposed to be as families. It's a time for that type of healing to come. And so I'm encouraging all the families I work with to spend time with their children. Don't get lost in the TV or the gaming, because they're quite happy to do that. And just allow that time. It's a real opportunity that we have right now to become focused and become together, and to come together, as families. And, there are some things in our traditions and in the prophecies that many of our people have that speak to that say, as those families who come closer together in our way, in the way that the Creator had taught us to be together, that they will be better off than other families. So use that opportunity and that teaching. As service providers, mental health providers, I try to emphasize with them just as much, but drug and alcohol counselors, medical providers, just start calling people within your community. Call elders and say, we were just wondering how you're doing. I'm going to check in on you every week if that's okay. I just thought I'd give you a random call and just see how you're doing with this. We're kind of all isolated right now. Have you had any symptoms? Are there things that you need? And this is really important with elders, that we're going to find that many of our elders do not have food, but won't tell anyone because they don't want to ask for help or feel like a charity of some sort. And so we need to check with them and just walk through some of those things. Is there anything in your house that needs to be fixed? You might find the plumbing's not working. And so we need to just let people know that we're there for them. We also need to call upon our traditional leaders and check on them. They've taken care of us for generations. We need to call them and visit them through technology, and to let them know that we care and that we're concerned about their well-being also. Many of our healers will tell you that it's very hard to be in a position in life where people take and take and take, and there's no giving back. And so we have to, this is an opportunity to really care for our traditional leaders, our elders, and to involve your children in that. So when you call them, when you FaceTime them or Skype, whatever it might be, Zoom, then get the kids on, get your children on, tell them, say hi to grandpa, hi to grandma, say, how are you doing? Things like that. Now, to give you an example, I have I have a great grandson, and my great grandson, I had an opportunity to be with him the other day, and we went outside for something, and I gave him some hand sanitizer, and I rubbed some on my hands and went like that. And he says, "Oh no, Grandpa, you got to do this." And he showed me a surgeon's way because he got that from Head Start. Head Start had trained them how to do the 20-second washing with the sanitizers, and he was a little expert at it. And he showed me that we need to get more of those kind of things. And my great grandson is eligible to teach folks if you. So with these higher risks for domestic violence, let's just note some things that have been happening. Yesterday, the District of Southern California U.S. Attorney's Office stated that they're going to make a significant effort to decrease risks for domestic violence by identifying and prosecuting people who have DV or IPV involvement or in their history that are possessing firearms, because they've recognized the increased risk that puts the surviving family in. And they have seen a dramatic increase, particularly in Southern California, of cases of use of firearms in domestic violence, and usually by people who have been repeat offenders. It's important to raise our hands to the U.S. Attorney's Office and say, you know what, you have a lot of responsibility, but you have no higher responsibility than the distinct responsibility you have to protect the citizens of Indian country. And we want them to recognize that and to begin to help us in educating our communities, in educating law enforcement, in bringing our tribal security up to a level that they see them, if it be the U.S. Attorney, FBI, whatever it might be, as true allies in this time, because we want to decrease risks of violence, and we want to be able to respond to issues when they occur. So with that, I'm just going to, I know we have a few minutes left. I'm going to open it up for questions. If anyone has thoughts that you would like to share, or comments or insights that you may have, please feel free to raise your hand, type it in the comment box, or just unmute yourself. I'm going to go back off the PowerPoint. Yes, there we are. So let's see. Well, without any questions, I would just encourage you to look at these. Oh, someone, go ahead. Carol.
Oh, well, I just wanted to comment when you were talking about the spiritual leaders and how much they give and how is not given back. Mm-hmm. Well, just to say that is that this is why when we learn from them, we learn to practice. And so we can practice some of this stuff with our own family, that we don't have to go to them, the minor things. And I just wanted to comment that from the Nakotas earlier this year, Richard Movescamp gave us some information, and I have tobacco ties over my front door, and it was suggested that be done to ensure that we would not, and I have been healthy, so I'm thankful for that, and I believe it works. And it's the power of prayer and belief that works. Thank you.
Yes, good words. Thank you so much. It also reminds me that some of our elders have said, and we used to, this is kind of a traditional practice that many of us had in California, was to, when we walked into the home of an elder, that the porch, there would be either sage or cedar that we could smoke ourselves down with and kind of take care of ourselves before we go in, putting ourselves in the right mind and in the right way before we connect with before we enter the house of this elder. And we've been encouraged to do that also. And what I found is that also helps us, it keeps us mindful when we're out. Maybe we might be getting groceries or something, but when we're out exposed to other folks, it allows us to take better care of ourselves. because we are also aware that we're going to be exposing others within our family and community. So thank you for that. Any other thoughts or questions? If not, I see that we are running up on our time, and I want to be respectful of that. Feel free to connect with me if you'd like. By the way, I work at the Tribal Law and Policy Institute, so my email is art@tlpi.org. I am the director of the the Center for Native Child and Family Resilience, which is a Children's Bureau special initiative to assist Indian country. So thank you for the time and for your participation today, and I'll turn it over to Susan.
Yeah, as hard as this segment's been, it's definitely I know personally has reminded me about just our interconnectedness to each other, and what one does can definitely be felt by many. So it's been difficult, but I know at least I work for California Tribal Families Coalition, but also the director of social services at Paula. And even with the distance, we've still had to be more connected and together and working together to solve problems. So that's been kind of neat to see. Thank you so much again for being with us today. And if you guys do have any questions, follow up with Dr. Martinez or either myself or Delia through the chat box. Everybody's just saying thank you so much. So, and if you joined us late, I just let everybody know that this was recorded and it will be up on our CQC YouTube channel. So find it there. Thank you again.